if your child signed up for a sport at the beginning of this school year, concussions are probably a concern for you. Concussions are now one of the 10 most common injuries among athletes. This morning, we look at how to treat a brain injury and the lingering impact it could have.
Sports, falls, car accidents all have one thing in common. They cause concussions. Together, they result in nearly 10 million a year.
When somebody hits their head, it changes the brain electrical activity pattern.
According to UPMC, 5 of every 10 concussions, half, can go unnoticed, leaving patients at greater risk.
If we know, for example, that there's still some abnormality in the brain and that they would be subjecting a brain that hasn't healed yet to the potential of another hit.
So what do you do if you or your child sustains a concussion? Experts say rest and avoid strenuous mental tasks. Doing things that use a lot of brain power can increase your risk for post-concussion syndrome, depression, or memory problems. You should also avoid Advil, ibuprofen, and other pain relievers. Those could up the risk of bleeding. Researchers are now looking into new treatments for concussions, one of which is a device that uses magnetic stimulation to reduce symptoms. It's in the testing phase, but results are, so far, pretty positive.
Now, if you don't get the right treatment for a concussion, it could delay recovery and increase your risk of developing issues like dementia.